Very good. So what Paul presented just now is a overview of Medicare and insurance. But now we're going to get into some of the more details that some of those questions were alluding to that we just showed a few minutes ago or a minute ago. So John, also, Paul did a nice job of introducing himself, and I didn't introduce myself. I worked at Chrysler for 30 years. I was in the finance office all over the corporation. And at that, when I was working, I got to know John Kaiser very well. He also worked at Chrysler in the finance office. So John is going to do two presentations, one on Medicare Advantage and supplemental plans, MEDIGAP. And then we're going to have a break. And then John is going to pick up again for Medicare Part D, which is the drug plans. So John, why don't you go through a little bit on some of those more detailed questions about how Medicare Advantage and Medicare supplement plans, how do you make those choices between those two options?
Thank you, Howard. Good morning. It's my pleasure this morning to present Understanding Medicare Advantage Plans and MEDIGAP plans, also referred to as supplemental plans. Medicare covers 80% of your approved amounts for hospital and doctor services at participating hospitals and doctors. You can also find out what's covered by the Medicare and You booklet that comes out every year. You can get it online, or you can ask them to mail you a copy. The new one just came out for 2025. However, to cover the remaining 20%, though, there are Medicare Advantage plans and MEDIGAP plans, also called supplemental plans. You're also going to need coverage for Medicare Part D drugs. There's a detailed document I wrote. It's titled Understanding MA and MEDIGAP Plans. It's available on the NCRO.org website, and you look for it under the Health Insurances tab. For 2025, Medicare's deductible for Part A services, again, that's the hospital, is over $1,632. I don't have the number. It won't be out till October for 25, but it's $1,632 for 24, and I expect it'll be up from that. It's for each benefit period. So if you enter the hospital multiple times, you get into that cost each time, which is a surcharge per day, up to $1,632. Part B services, doctors, there's an annual $263 deductible that Medicare charges, and that was $240 this year. The type of plan and the coverage you decide upon, that determines how these Parts A and B Medicare deductibles get paid. Some plans cover them, some don't. It depends on the plan. We'll talk about that. But however, these amounts are in addition to the 2025 Medicare monthly premium of $185. That's taken out of your Social Security check, or if you're not signed up for Social Security, then you got to pay that directly. Those folks who are fortunate enough to have higher incomes, they're going to pay more than $185. There's a sliding scale all the way up. It can get pretty expensive. However, this is based on the fact that you have higher income. Important, if Medicare covers the service, then a Medicare Advantage plan or a MEDIGAP plan covers the 20%. So when you get these plans, it doesn't detail what they cover. It's based on what's covered by Medicare, and again, that's in that booklet. It's not necessary for spouses to have the same insurer. There's advantages in most cases with insurers. They'll give a discount if they're both with the same insurer, or if you have someone living with you. Medicare plans, Medicare Advantage plans, and MEDIGAP plans do not cover assisted living or long-term care. MA plans are insurance plans separate from Medicare. What that means is the insurer is handed off 100% of the coverage, unlike in a MEDIGAP plan where it's the 20% you're covering. These plans are covering 100%. So you're no longer covered under Medicare. There are no pre-existing condition limitations. That means that regardless of your health, you're eligible to sign up for a plan, even if you're changing plans later on or newly enrolling. Zero premium plans are now available, very, very popular, but they still have deductibles, copays, and out-of-pocket maximums, and that varies depending on the plan. Medicare Advantage plans today include coverage for Medicare Part D drugs. Very few plans don't. I think there's only one type of plan that does not. Most plans now also include dental, vision, hearing options with an allowance or reduced cost, but you got to go to a network provider, which is somewhat of a restriction, particularly for dental. In some cases, though, I think you can send the bill in, but you don't get the same amount of coverage. Many also offer free gym memberships, or they offer an out-of-pocket allowance for over-the-counter medical supplies. So you can go buy aspirin and Band-Aids and stuff, and the amount varies, but $25, $50 a quarter that you can submit and get reimbursed for those kind of supplies. Advantage plans can include free in-home care and other benefits as eligible, and your doctor approves. The key there is if the doctor approves. They advertise this kind of coverage, but it's really restricted to those who meet a certain need. You can choose an MA plan based on the type of healthcare services you need. So you got to take a look at, just exactly how healthy you are, and you can't predict the future, but that's part of what you have to consider, what you're going to need in the way of services. Pricing is not based on age, sex, zip code, or health conditions, unlike a MEDIGAP plan. It's straight pricing for everyone. And like I said before, some cases, there's no premium now. Out of state can be out of network, but not for all plans. The plans are more and more developing broader networks. Example, you could get coverage in Florida with your plan, but it's not for all plans. You have to check your specific one. Some newer plans charge the same both in and out of network. They let you be in or out of network, and they don't differentiate on your cost. If you initially enroll in an Advantage plan, you still have 12 months to change back to original Medicare and get a MEDIGAP plan, and there would be no underwriting. I'll explain underwriting in a bit, but so you have that 12-month, I'll call it a grace period. You can join or change MA plans during the annual election period, October 15th to December 7th of each year. That's coming up. That's one of the reasons we have this webinar. You can also change plans during the open enrollment period of January 1st to March 31st, but you cannot enroll. So in that period, October 15th, December 7th, you can enroll, you can change, you can get in, you get out. But in this period from January 1st to March, you cannot enroll. You can change plans, you can get out. With Advantage plans, you're going to receive only one billing from the insurer. You won't see anything coming at you from Medicare, but you still have to pay that monthly Medicare premium. That's part of your Social Security payment. You have several choices for Advantage plans. You can get the basic HMO plan. That's the least cost, but it really limits you in terms of your providers. You can get an HMO point of service plan. You can be seen by a provider outside your network. PPO plan, which is really the most popular, it's pretty much what everyone goes with, has more flexibility. You can go to any primary care doctor or specialist, but pay less than network. But when I say you can go to any primary care doctor, it has to be a doctor who accepts an Advantage plan. And that's very, very key, because if your primary doctor that you have today does not accept Advantage plan, then that's a problem. Or if you have a specialist that does not accept the Advantage plan, that is different than a MEDIGAP plan, which generally everyone accepts. Your plan choice determines your premium, your deductible, your copays, and your out-of-pocket maximum. In the past few years, the MA plans have become much more attractive, and I put a chart in to show you just how much they've grown. So in 2023, 51% of the people signing up are going with Advantage plans. That does not mean 49% are taking MEDIGAP plans. The other 49% is made up of company plans, group plans, etc. I think the number is 30-some% for MEDIGAP plans. So now let's spend a few minutes on MEDIGAP plans. It's a private insurance plan designed to cover the 20% balance that isn't paid by Medicare. For 2025, the deductible for Medicare Part B is $263, as I mentioned. At age 65, or when you are first eligible to enroll, you have what's called guaranteed issue, meaning pre-existing conditions do not apply. So it doesn't matter what your health condition is at age 65 or when first eligible. We say first eligible because some people have coverage through their spouse and they don't have to sign up at 65. They don't have to sign up to their spouse loses their coverage. After your initial enrollment in a MEDIGAP plan, you do have 6 months to change MEDIGAP plans. So you get in a MEDIGAP plan and you want a different one, you've got 6 months with guaranteed issue, no underwriting. But unless you enroll at age 65 or when you're first eligible to enroll, the insurer could deny you coverage or charge a higher premium due to your pre-existing conditions. I'm not talking within that 6 months, I'm talking beyond that. You might get in, but you might pay a higher premium. Example would be if you were a smoker. Medical underwriting now is a review of your medical history and involves a series of medical questions, including the discussion of the prescription drugs you take and why. It's not as intensive as, say, an interview or a exam for life insurance, but it is a series of questions, and each insurance company will ask these questions before they allow you to sign up if you're outside the period where you can enroll without underwriting. Certain conditions related to the heart, for example, cancers, etc., and pending or recent surgeries can disqualify you. If you had a recent surgery, they might tell you got to wait a year. But other conditions, they don't want to insure you. They're trying to get the healthiest person they can for their operating cost and their experience rates. It is possible to enroll in a MEDIGAP plan by paying a higher premium, like I mentioned, due to certain medical conditions, for example, smoking. MEDIGAP plans do not have any open enrollment restrictions. Unlike Advantage plans, you can change plans anytime. However, if your health deteriorates and you're not within that first 6 months when you signed up, you may not be able to pass the underwriting. So that's kind of important. That's what people run into. They get into a plan, they've had it for several years, it's getting expensive, they want to change, they can't change because they can't pass the underwriting, their health has deteriorated. MEDIGAP plans coverage is determined by the plan codes, the alphabet A, B, G, K, and N, and these are standardized among insurers. So if you buy a plan from one insurer and it's a G plan, for example, and another insurer G plan, the coverage is exactly the same. The plan you choose will determine your premium and copays. Premiums are higher than MA plans, especially if MA plans a zero premium, but they're higher and they can vary greatly by geographic area. Someone, for example, upstate in Michigan would pay less than someone in the metropolitan area. Unlike MA plans, MEDIGAP plans are based on age, sex, tobacco use, zip code, and county, and your health after initial enrollment. MEDIGAP plans do not cover dental, vision, or hearing. You're going to need that separately if you decide to get a plan. They do cover skilled nursing if you meet certain requirements. This is a chart of the various plans. The reason the F plan is red is because it's no longer offered if you weren't 65 by 2020. Those plans have gotten pretty expensive for people because there's no young people joining. You know, by young, I mean 65. There's no younger people joining, so their experience rate's quite high. Those premiums are quite high, and those people are caught because they can't change if they can't pass underwriting. That's an example of someone might be switching from a supplement plan into an Advantage plan. The G plan, that next column there, is the most popular because it has the best coverage. It'll be the most expensive of the group. At age 65, you can do a plan like that for about $125. I'll show that later. An N plan, though, is popular because the only difference between an N plan and a G is you have to pay $20 an office visit. That's noted up in the corner. $20 for an office visit and $50 for an ER visit. I have that plan, and frankly, most times the doctors don't even charge the $20. However, if you're going to get in a position where you're running to the doctor's office quite frequently in a year, then it wouldn't necessarily pay. And you would have to pass underwriting to go from an N to a G. So more on the subject. Most states allow you to enroll or change MEDIGAP plans at any time. However, if you're in an MA plan and you just want to switch to a MEDIGAP plan, because you have that 12 months, make sure you're eligible to make the change under the 12-month rule. You got to stay within that 12 months. If you originally sign up for a MEDIGAP plan, I think I already mentioned that, you have 6 months to change your mind on that plan. Never, this is very important, never cancel an existing policy without written proof of your new policy from the insurer. People will apply for a different plan and cancel their old premium because they don't want to get doubled up without having written proof of the new plan, and things can go wrong there, and then you're without insurance. MEDIGAP plans do not cover drugs, Part D drugs, and when you enroll in a MEDIGAP plan, you have to separately sign up for Part D. And I'm going to cover that in the next presentation, Part D. Several MEDIGAP plans cover foreign travel with a 20% copay, but most Advantage plans do not. Some may for emergencies. So now I'm going to do a couple charts that try to compare the two. The NCR rule does not recommend an Advantage plan versus a MEDIGAP plan. It really varies based on your needs, based on what you want to spend, based on your comfort level, how much risk you want to take, so to speak, of being out of pocket every year. But I'll get into that in a minute. So the following two charts do that comparison. While it's difficult to calculate those dollar differences because of the variables involved, you'll see the differences when I show the chart. Everyone has different circumstances in terms of health, affordability, as well as the comfort level. So what I've done here, it's an attempt, because of now they have these zero premium plans, is to do a comparison on 2 pages. This is the first page. I've called this an ARP Advantage Open Plan. I should have had the language United. It's offered by United Healthcare. It's sponsored by ARP. So this is a United Healthcare plan. It's called 1 PPO. And on the right, I used a G plan, which is the most popular. And you can see on the annual premium on the left, there's no premium. There's no monthly premium. Whereas on the right, depending on your age, you could be $119, or you can be age 80, be $220. You have some people in their 80s paying $300 a month. That's $3,600. Keep that in mind, $3,600. Now, under Advantage plans, if you go in the hospital, you're gonna have to pay for the first 1 to 7 days. You're gonna pay every time you go in the hospital. That's at $1,632 max. Now, if you're under a GAP plan, you see on the right, unlimited, no cost. So the $1,632 or the hospitalization is covered. Part A is covered pretty much on what is covered under a G plan. So you wouldn't pay anything you went in the hospital, no matter how many times. The Medicare on the left, Medicare Part B deductible of $263 is included, which I'm surprised, but it is included. Whereas over on the right, a MEDIGAP plan, that's $240 is the 2024 number. It's up to $263 now, but that's the number for 24, and you would pay that. So there's no GAP plan where you don't pay the Part B deductible. The drug premium, again, they're charging $0 under Medicare Advantage. There's no deductible, and the costs are based on the drugs. The drug costs are pretty much the same under both plans. You'll pay 25% for a brand drug, but under a MEDIGAP plan, you could have a premium $34 a month. I actually have a drug plan with a 0 premium, so that number will vary quite a bit. But for this exercise, I use $34 a month, and then the Part D deductible, like I said, is 0 on the left, but it's $545 for 2024. Again, the drug cost is based on the drugs. Network-wise, your participating doctor can be out of network. So that is like very, very important that if you're going to go with an Advantage plan, make sure your doctors of your choice, because you have specialists too, are in network. They accept Medicare Advantage. You will not run into that with a Medigap plan. Pretty much every doctor accepts Medigap plans, and there are no networks where you can have networks. In the case of this particular Advantage plan, though, they're pretty flexible on the networks. The annual out-of-pocket cost with an Advantage plan is $4,500. What that means is after you've spent $4,500 on deductibles, copays, etc., everything is free. No more charge. In the case of the Medicare plan, once you've hit that, you pay that $240 under this plan. Everything is covered. Everything. So what happens is you get someone who's age 80-some years old paying $3,600 because they're paying $300 a month. They look at the fact that the most they can pay under an Advantage plan is $4,500, plus they get these other coverages, which I'll cover on the next page. They do make the switch. Or you get a young person who says, hey, I'm healthy enough, I can probably pass underwriting. Let me go with a zero plan. I'm going to have very few costs, and I'm not going to pay that monthly Medigap premium. It's a difficult decision. The second page is just to give you more information on what's covered under each plan. Your primary doctor's covered. A specialist, you pay $35, and I'm on the left side. Prior authorization, yes. No for Medigap plan. This is a big issue. A lot of people complain they can't get the prior authorization, or that their Advantage plan gives them a hard time over getting referred to a specialist. That's the biggest complaint. There is that benefit, though, for dental, vision, and hearing. There's allowances, which you don't get with a Medigap plan. You have to either get a policy on your own or just go out of pocket. Physical therapy is not covered as a copay under an Advantage plan, but it's covered under our GAP plan. Mental health, outpatient surgery, these are all costs. Emergency room visit, ambulance service, those are costs. Those are all covered under a GAP plan. There's a gym membership included, although some insurers are including a gym membership. United Healthcare is including a gym membership even with a GAP plan. And there's that over-the-counter spending I mentioned where you get money each quarter for aspirin, Band-Aids, and stuff. And at the bottom, I've shown you the participation, 51%. Michigan is higher. For Medigap plans nationally, it's around 25, but Michigan's higher as far as Medigap plans. So I'm open for questions. Hopefully I've explained it. And again, I'll tell you that there's a very detailed document. It's got more than even my words on the website that you can refer to.
John, can you see the screen?
Yeah. Oh, I can see the question, Jill.
Okay.
Okay.
Then go through them.
All right. First question I've got is there a list of available of which Medicare plans and Advantage plans work in multiple states, such as Michigan and Florida? The Medicare.gov site, which I'm going to show you when I do the Part D plan, has a box you can check where you can look at Medigap plans or Advantage plans. I'll show it to you shortly. And there you can go in and put your information in, and you can find out what's available in which states. The simpler way, though, might be just to talk to one of our consultants. They are licensed in multiple states, and they would know which states have what in terms of coverage and the premiums and all that. I would do it through a consultant and I would use one of the three. Am I able to switch between Advantage plan and Medigap? I talked about that. If you go into an Advantage plan, you've got 12 months to get out and go to Medigap without underwriting. Otherwise, anytime you try to move from an Advantage plan to a Medigap plan, you're subject to medical underwriting after the 12 months. Are there benefit advisors NCRO recommends working? Yes. Via Benefit has a connection with Chrysler because they're part of Benefit Connect. But aside from them, we have three on the site, which will be addressed later. They're what they offer and everything, and more information on them is in a presentation that follows this one. If you get a Medicare Advantage plan, do they pay for Part B, or would I have two monthly premiums, one for Part B and one for Advantage plan? Well, using the example I just used with United Healthcare, they pay for Part B. They don't pay for Part A, but they pay for Part B, and there's zero premium. So you would add zero premiums. So it really depends on which plan you get. And why wouldn't you get one where they pay for Part B? We looked up All Right, and they're apparently a vendor to companies for benefits administration and more. So there was an earlier question about All Right, and they're just one more insurance company out there, like Aetna, like Blue Cross, etc. They are not affiliated with Chrysler. Okay, there's a group of PNHP physicians for a national health program is raising alarm about limited provider networks, prior authorization requests, prize medical bills, and denial of care. This is an example of the complaints that people are registering about Advantage plans. I have friends on Advantage plans that have had no problems, but they're pretty healthy. One of the big things out there is a lot of people are being denied coverage when they go for extra services. They're getting it approved, but they got to go fight for it. And that's one of the rubs on an Advantage plan. What I would do if I were you looking for an Advantage plan, I would just Google, see what some of these complaints are. The key one for me, though, is make sure your doctor's covered and make sure the drug plan that's within the Advantage plan covers your drugs. Is there a difference if I got MEDIGAP through Via Benefits or through Double Health Advantage? Not if you use the same broker, not if you use the same insured. If you got an Aetna plan, throw that out there. If you got an Aetna plan through Via Benefits, you got it through Double Health, it would be the same plan because it's the same insurer. The difference gets to be how many different insurers does Via Benefit offers? Like when you go into a store and you're trying to buy a product, how many choices do you have? And so certain of our consultants have more options for you as far as insurers, and the more options you have, the better opportunity you have for getting a lower premium. So no, if you get the policy through either one, it would be the same. There's nothing wrong with Via Benefits. It's just that we've had good experience with the three we recommend on our website. Are there plans for dental and hearing if I choose MEDIGAP? Yes, they are, but you've got to price them out because a lot of them have a waiting period if you need a root canal or special services. And you're paying a lot for maybe $1,200 of coverage. And if you're paying $40 a month, that's $480 to get this coverage. You got to do the math on it. Most people end up just going out of pocket. Again, though, if you have an Advantage plan, that coverage is pretty decent. I mean, you're getting a pretty good chunk of money to go towards any of those services. But does the NCRL take a position on which plan is better, MEDIGAP versus Advantage? The NRL seems to take a very negative position on Advantage plans, but the ARP is pitching me on a zero premium MA policy versus my MEDIGAP, which has doubled in cost since I retired. So this fellow sounds like he's older, and his MEDIGAP policy is to keep going up on up every year on him. And he's trying to decide if he should just get out of it. In this situation, a lot of people, a lot of seniors who are already, like I said, paying $300 a month, that's $3,600 a year. They're saying, hey, why not switch over to the Advantage plan? Your worst case in this example I showed was you'll spend $4,500 a year, but you're almost spending that already. So I do know of quite a few seniors who say they give up on paying that high premium and just go to an Advantage plan. We do not take a position on it because you can see that it's really six of one, half dozen another. We just try to point out the differences. The NRLN, our national organization, they're negative on it because they feel the government is pumping too much money into Advantage plans at the sake of Medicare, the funds available, and because they feel that, hey, why not have MEDIGAP plans with a dental option? So they don't like Advantage plans from the perspective of it's costing it's costing too much. The fact that they're zero premium and they're giving away all these bells and whistles, and that may not hold up.
That's our last question, John.
Okay,